Today in this video we will talk about phobias. Why it is important to talk about phobias? Because it is the most common anxiety disorder and the third most common mental disorder in the general population is specific phobia. The difference between fear and phobia is that fear is a rational reaction to a potentially dangerous event or object, whereas phobias are irrational fear triggered by either specific or general events or item. A phobia is an unreasonable fear caused by the presence or thought of a specific object or situation that usually possess little or no actual danger. It can interfere with a person's ability to function. There are three main types of phobias that are recognized by the American Psychiatric Association. These include specific phobia. This is an intense irrational fear of a specific trigger. Then we have social phobia or social anxiety. This is a profound fear of public humiliation and being singled out or judged by others in social situation. Third, we have agoraphobia. This is a fear of situations from which it would be difficult to escape if a person were to experience extreme panic, such being in a lift or being outside of the home. A phobia can significantly impact person's life because of its intense symptoms that are a sensation of uncontrollable anxiety when exposed to source of fear, a feeling that the source of the fear must be avoided at all costs, not being able to function properly when exposed to the trigger, an acknowledgement that the fear is irrational, unreasonable, and exaggerated, combined with an inability to control the feelings. The other common signs and symptoms of phobia is trembling, sweating, shortness of breath, rapid heartbeat, fainting, choking, chest pain, nausea, dizziness, avoidance. Now we will talk about what are the different types of phobia. The types of phobia I will share here are not comprehensive but offers a glimpse of many phobia that can have a serious impact on person's life. So first of all, we will have here a claustrophobia. Claustrophobia causes an intense fear of enclosed spaces. If you get very nervous or upset when you are in a tight place, like an elevator or crowded room, you might have claustrophobia. Being inside an enclosed space can trigger symptoms that we talked about earlier. For example, shortness of breath, sweating, shaking, nausea, or a full-blown panic attack. Next, we have aerophobia. It is a fear of flying or fear of being on an aeroplane. Aerophobia is an extreme fear of flying. People with aerophobia might feel intense anxiety before or during a flight. This condition can interfere with ability to travel, work, or play here. Next, we have arachnophobia. It is an intense and irrational fear of spiders or arachnids. People with this condition may show some symptoms similar to a panic attack when presented with their fear. Researchers believe causes might include a traumatic past experience with a spider, childhood exposure to parents' arachnophobia. Now we will talk about the causes of phobia, that how and why a people develop phobia. Many phobias start because of an intense bad experience or panic attack related to a specific object or situation. A phobia might be a result of something that happened to you when you were younger. They can be caused by a stressful or scary situation. If a certain phobia runs in your family, you have a chance of developing it. Sometimes, even seeing or hearing about a bad experience can be enough to trigger a phobia. It can be genetic or learned behavior. There may be a link between your specific phobia and the phobia or anxiety of your parents. This could be due to the blend of genetic and learned behavior. Another reason is brain function and structure. Those with specific phobia trigger certain part of the brain, while a person without these phobia does not have the same response in the brain. Also, a person with specific phobia can have a different brain structure than a person without that phobia. Talking about the treatment, there are many different types of treatment available for phobia that includes therapies, medicine, and lifestyle changes. The best treatment for specific phobia is the form of therapy called exposure therapy. There are different medicines available like beta blockers, sedatives that can help in reducing the symptoms of phobia. These drugs block the stimulating effect of adrenaline, such as increased heart rate, high blood pressure, pounding heart, and shaking voice and limbs that anxiety causes. While sedative relax by lowering your anxiety. Sedatives are used with caution because they can be addictive. Talking with a mental health professional can help you manage your specific phobia. The most effective treatment are exposure therapy. This therapy focuses on changing your response to the object or situation that you fear. Gradual, repeated exposure to the source of your specific phobia and the related thoughts, feeling, and sensation may help you learn to manage your anxiety. For example, if you are afraid of elevator, your therapy may progress from simply thinking about getting into an elevator to looking at picture of elevator to going near an elevator to stepping into an elevator. Next, you may take a one floor ride, then ride several floors, and then ride in a crowded elevator. Then there is also a cognitive behavior therapy that gradually exposure combined with other ways to learn how to view and cope with fear object or situation differently. Generally, this therapy successfully treats specific phobia.